So we've seen on the news and within various bits of data that have been published so far that the BAME community, in particular the Black community, is more affected by coronavirus. That is to say that there is a higher rate of infection and a higher mortality rate within the Black community. And so I wondered if you could tell me what that means for you and for the Black community at large. So for example, we hear that Black men are up to 4 times more likely to contract coronavirus than the general population. What will that mean for a Black man going out into the world after lockdown is eased, looking for employment, looking for housing opportunities? And also that Black people are dying are more likely to die from COVID-19. What does that mean for our community? We know, for instance, that there are frontline roles that are where Black people are overrepresented or highly represented. And so therefore, the more contact that you have with the general public, the more likely you are to contract coronavirus. But beyond that, did anybody have any experiences personally or within their communities that they'd like to share about that?
Initially, I thought there was like a sense of vulnerability, being Black. You hear about the things like prostate cancer, Black men are a lot more likely to get it. And then you hear about coronavirus, the mortality rate being so high for those people of color. And that made me feel slightly anxious because, I've got my grandma, she's elderly, she's of a Black origin, and it can make you panic. But I just wonder if there's going to be something in play where when people go back to work and the quarantine is lifted and the lockdown is lifted, if that's what you want to call it, if there will be maybe a priority for Black people to get vaccinated or Asian people to get vaccinated, or if there will be like priority testing in workplaces for those people of color. Those are the sort of things I'm questioning. Okay.
And Jackie, can I pull you in here? What are your thoughts around this? What does it mean for Black people that they are more likely to contract coronavirus and more likely to die from coronavirus?
I think as Ashley has just said, it's like being where there are vulnerabilities, applying appropriate risk assessments and risk management, which is what Ashley's speaking to. So I concur with that. And actually from NHS England, there was a requirement a few weeks back that all NHS services and social care services should be putting into place risk assessments that cater for the fact that Black, Asian and minority ethnic communities are disproportionately affected by the virus. That what's really interesting is how long or how difficult that is to put into practice, in the sense that some parts of the system seem to be quite resistant to doing that, even though the outcomes are of that nature. And that for me speaks to some of the systemic racism that we have to contend with in order to raise the level of protection in relation to our needs. But these are some of the challenges that are around that are urgent to be addressed. And because the reality of the experience is that it just exposes that which is already sort of present, and that's the challenge. Yeah.
Leah, can I ask you what you think it might mean for the Black community going back into the world after lockdown, being sort of branded as, amongst other BAME communities, to be more likely to contract coronavirus, to be more likely to die from coronavirus? Do you think that will have any kind of consequences for the Black community?
I think it undoubtedly will. The feelings of anxiety, concern, worry for family and loved ones, and I guess the element of racism and structural inequality that perpetuates this and ensures that people may not feel able or probably able or accepted enough maybe that they can speak up to their employer and say, I need to have X, Y, and Z in place in order for me to be able to come back to work and work effectively for you. Because it's very clear to anyone who can see, anyone with an eye we can see that Black people are dying at a much faster rate, and we need the protection in place to ensure that if we are going to work and we are going out there, that we are protected and safe in what we are doing.
Thank you, Leah.
The Black frontline staff are not getting the acclaim that is due to them, you know, that they've been like forgotten about, really. Because when you see on the media, when they're talking about all these nurses and things like that, you know, we don't really see a lot of Black frontline staff on, you know, like on their mainstream media. So there's a lot of talk like that.